This is what it looks like when the coronavirus restrictions are back. Long lines have formed outside the testing facilities in the district of Gütersloh. The new restrictions here and in neighbouring Warendorf took effect at midnight. The mass testing follows a huge coronavirus outbreak at Tönnies slaughterhouse, where more than 1,500 workers have contracted COVID-19. Now, some 600,000 people are affected by the restrictions. Gütersloh's mayor told DW he's furious.
I'm angry with the company of Tönnies. I'm angry with the system behind of it. I'm angry with the system of subcontractors, which is totally intransparent.
People had to put up with long waits to get tested. I want to get tested and do my bit to help find out whether we're all infected here in Gütersloh or not. We want to travel to Bavaria on Saturday, and the condition is to present a negative coronavirus test. That's our goal today. Indeed, with summer vacation about to begin, officials in popular destinations like Bavaria say Gütersloh residents are not welcome unless they show proof of testing negative for the virus. Neighbouring Austria has gone even further, targeting Germany's most populous state.
Our neighbour Germany, with its state of North Rhine-Westphalia, has shown how quickly the situation can turn dramatic. We were therefore forced to issue a level 5 travel warning for that state. We hope, of course, that the situation there will quickly improve and that there won't be a further spread across Germany.
Und hoffen natürlich, dass sich auch dort die Situation schnell bessert.
Overall numbers are still low in Germany, but the latest local outbreaks are causing concern. The meat processing industry in particular is under pressure. Employees' living conditions are being blamed for the spread of the virus. 23 workers have tested positive at the Wiesenhof plant, Germany's biggest poultry plant, where mass testing of over 1,000 workers got underway today.
Let's have a look at this with Christian Lindmeier, who speaks for the World Health Organization and joins us from Geneva. Welcome to DW. What do you make of German efforts to control this new outbreak?
Well, thanks for having me. Well, it's a typical scenario where you don't have community spread in the whole country anymore, but we have now a cluster of cases next year, a big and large cluster of cases. And here to test and trace basically every single person, to offer tests for everybody is a really good idea, because this is how you find out where the virus is, how many people have the virus, who the contacts are, and this is the best way to contain it.
So this sort of locally controlled lockdown, rather than being controlled from the centre, you think this is what we're going to have to get used to?
This is actually what we should aim for. Then instead of having a community spread, which we cannot oversee where the virus is, we will have to work on trying to get the response so strong and so strict, and testing so strict and surveillance, that we can respond to individual clusters, individual cases immediately. Ideally not as late that we have 1,200 or more cases like now, but earlier than that, and then contain those cases and maybe lock down an individual place, maybe only have a city, a town under stronger measures, rather than having the whole country to go into a lockdown scenario. That is most likely something we will have to look forward for the future, but actually have to work forward to.
Right. Meat processing plants have been at the centre of 2 outbreaks here in Germany and 2 in the United States in May. Does the meat processing industry have a coronavirus problem?
The way we see this right now, and we don't have the full information of what the conditions there were, what the living conditions, the working conditions were. So it seems rather that it has to do with a combination of factors there, rather the fact that it is a certain species of or a certain type of factory. It looks like it's rather the combination of, again, living conditions, working conditions, and the fact that in a close environment, people can easily transmit the virus from one person to the other. That's something which has to be controlled. Other sort of branches don't have that same scenario in their working environment. Of course, other companies have to put out a plan on how to enable even coming back to work and how their workers can go back to offices. So that is a very different scenario than this very strict and very strongly regulated business.
OK, and just looking ahead, the WHO is warning that the global number of COVID-19 cases could reach 10 million next week. What does our future look like? Will numbers and deaths just keep rising until a vaccine is developed?
Well, globally, the figures are rising. Let's not forget that only in Central Europe we have a couple of countries which have declining cases. So, but globally, we reach one peak after the other. And yes, we will reach most likely 10 million next week. So until we have a treatment, first of all, until we have a scenario where every country can trace and find and survey every single case and have a better control of the virus in their country, we will most likely see rising cases on a weekly basis. That is not the best scenario, but of course we will have to deal with this and have to avoid more and more people coming back with virus once they get infected somewhere else. So it's a long journey. It's not a short sprint. It's a marathon we're in.
Thank you for joining us, Christian Lindmeier from the World Health Organization.
Thank you very much.
Now let me bring you up to speed with some other developments in this pandemic. India has registered 16,000 new cases, its highest ever daily increase. And the government has called in the army to manage new treatment facilities in Delhi. The EU may ban travellers from the United States, Brazil and Russia when it reopens its external borders, according to the New York Times. And New York and Berlin have cancelled marathons due to coronavirus concerns.